Forgot to unmute myself. Hello, everyone. Happy Wednesday. We're going to go ahead and get started. As I know people are probably slowly trickling in, I just want to be very mindful of everyone's time as I know we're all super busy right now. So just really quick on our agenda, we have our EPI updates as well as presentation with our oral health clinic folks and a presentation on immunizations from our clinical folks as well. And then, of course, at the end, we will have time for Q&A. But as always, if you have any questions as things come up, you're always welcome to put that in the chat as well. Just as a reminder, we would like you to keep your mics off if you're not talking. And you're also welcome to, and then one more housekeeping tip, if you could please put in the chat your name and what school you're from or organization you're from, just for our own notes. With that being said, we only have our announcement of our school health update newsletter. Again, if you're not subscribed to it, you can click the link, or you can reach out to one of us and we're able to get you subscribed to that as well. It just goes over everything that we do in these meetings as well as a bunch of other resources that we offer. With that being said, we have our respiratory slides for Pima County. Megan, are you on the call?
Yes, I am. Thank you very much.
The floor is yours.
Excellent. Thank you. Again, my name is Megan Riddle. I'm an epidemiologist with the Pima County Health Department. Next slide, please. And we'll be going over our respiratory slides. So first one up is our RSV. In week 3, which is about a little over a week ago, we can see that RSV is starting to climb. As we saw last year or last season, we did see this peak late, and we are seeing it again this season. Next slide, please. Our next slide is influenza, and we can see we had our peak at the end of December, and we are now starting to slow down. We are still relatively high, but we are in the decline. Excuse me. Next slide, please. And COVID, we see a steady decline. COVID is still there, but it is all declining. As again, this is about almost 2 weeks ago data on the website. I know I've provided these in the past. You can always see them updated, usually on Wednesdays or Thursdays. And I believe this is the last slide for our respiratory update. Oh, sorry. This is a combination of all three. If you just need a quick peek, you can see how all three respiratories are declining, except for RSV, excuse me, is increasing at our peak. And this should be the final slide. Thank you.
Thank you so much. If there's any questions, please feel free to put them in the chat for Megan. If not, we can move on to the National Children's Dental Health Month. Suzette, are you on the call?
Yes, I am. How are you?
Good. How are you?
Great, thank you.
The floor is yours.
All right. All right. Hello, everyone. So happy National Children's Dental Health Month. Each February, the National Children's Dental Health Month is observed to raise awareness about the importance of the good oral hygiene for children. It also lays the foundation for strong teeth and, of course, healthy gums throughout the life. So the good dental habits at a young age can help prevent the tooth decay and contribute to the overall health. So we have a few resources to share with you guys today. Next slide, please. Thank you. So one of the key initiatives that we're highlighting today is Cavity-Free AZ. Now, this is a school-based program, and it's all about reducing the childhood cavities in Arizona, of course, through prevention strategies like fluoride treatments, dental sealants, and promoting regular dental health checkups. The goal, of course, is to, pretty much help kids maintain the healthy cavity-free smiles, and we try to do the best we can with that. We will be part of an exciting community event that's called Give Kids a Smile. It will be taking place in March. So this annual event does provide free dental services to children that are in need across the state. They will be offering exams, cleanings, and oral health education. So it's an incredible opportunity to ensure that, pretty much every child, no matter their circumstance, gets the dental care that they need. Together, programs like Cavity-Free AZ and the Give Kids a Smile will play a crucial role in prevention and early intervention, which helps set the stage for a lifetime of healthy smiles. Next slide, please. Now, of course, when the word dentist is mentioned, a lot of children tend to get, scared thinking that it's needles, drills, or something uncomfortable of a procedure. That usually comes to mind, and also for adults. But the truth really is that dental visits, the visits don't have to be scary or painful at all. So we aim to try to make the child's visit with us to be positive. Our Cavity Free Easy program is available to over 130 schools, which include the Amphitheater, Flowing Wells, Marana, Sunnyside, and TUSD, as well as some charter schools that we've been out to. So this is a valuable program that does provide preventative services to children at the eligible schools. Now, for the schools to be eligible, they have to have at least 50% or greater of students participating in the National School Lunch Program. So when schools are eligible, they can apply to participate in this free program. And when we receive the school application, we'll reach out to the school nurse or the health assistant and we'll schedule a short education session. Usually about 20 minutes is what it takes for the educations. Now, the education sessions that we present to the classrooms have also been redesigned by the Arizona Department of Health Safety to meet specific language arts. So it provides a valuable learning experience for the students as well. Now, the services are free and they're provided right on the school campus. Now, it minimizes the time students spend out of the classroom. So, along with that, there are two components of the program. Now, the first one is we serve kindergartners, and for this grade level, the program helps identify early dental needs through the oral screening, along with the application of fluoride, which helps strengthen their teeth. Now, the second part of the program is for the second and sixth graders. Now, in addition to their oral screenings, the dental sealants will be applied on their adult molars, which usually around this age is when they start coming out, and it helps prevent their cavities up to 80%, which is a pretty big number. When the child brings their consent form signed by the parent or guardian, the child will receive that free service, along with the take-home results like a toothbrush kit. And of course, this is for all children who are uninsured or underinsured. They all qualify for either of the services. And it also helps to identify the dental needs. So bring awareness to educate parents and the child about their dental. Next slide, please. Now, studies show a significant reduction in cavities among children who receive sealants. So children with dental sealants are about 80% less likely to develop cavities in their molars. Healthy teeth also contribute to better school performance, which means no pain and the ability to attend school. The sealants are also cost effective, which helps reduce the need for expensive dental treatments in the future because we know how much that's going up right now. Most importantly, they provide access to care, ensuring that undeserved children at high risk for dental issues receive the dental protection that they need. Next slide. Now, what are dental sealants? At the top, you can see a permanent molar, maybe like the first permanent molar in a second grade child or the second permanent molar in a sixth grade child. The tooth underneath shows a sealant, which is a protective coating. It's applied to the chewing surfaces of the permanent molars. Now, the sealant does help prevent cavities and it seals out the food and bacteria, especially in the areas that are hard to reach with brushing. The process is super simple, it's safe, it's highly effective in providing long-term protection for many years. Now, because this does not require needles, drills, or anesthesia, the result is very positive experience for the child. Next slide, please. Now, the dental sealant program, the school-based dental sealant program was designed to focus on the uninsured and underinsured children. So here are the percentages of the children who either have no insurance or have some type of government insurance like Access or Kids Care. Next one, please. Now, by supporting the school-based sealant programs, you're helping ensure that every child can succeed, with a healthy smile, free of cavities. And our goal is ensuring that your students at your school have access to preventative and early dental services. That way they can grow up with the strong cavity-free teeth. We do look forward to continuing our work together so we can help create healthier futures for the children. Next one. Now, we do have great news. Give Kids a Smile is back. Unfortunately, the event was not held last year for a variety of reasons, but we're excited to be a part of it once again this year. The oral health program is actively involved in planning and outreach the committee. So we'll be joining several other agencies to provide free dental services to kids in need. This event is a fantastic opportunity. It's something to take advantage of, and it will help ensure all the children to have access to the quality dental care that they deserve. So we're really proud to support an important community initiative. To guarantee the appointment, pre-registration is required. It's very important, and it's open until March 2nd. So we have a QR code there that can be scanned for parents. There may be walk-in appointments available, but that's only if space and time permits. So it's best to get on that. Next slide. Now, some highlights of the event. Pima Community College dental hygiene students will be there. They'll be there to share some fun and interactive dental theme materials, along with demonstrations on best brushing techniques, flossing, how to help kids maintain healthy smiles. So it'll be a great opportunity to educate the parents along with the children. Also, a variety of dental services will be offered, all completely free of charge, which includes cleanings, exams, and fluoride treatments to support better oral health. So we're looking forward to the successful event. Of course, everybody spread the word. You can see the list of the community agencies that will be providing the free services, and there will be individual volunteers as well. Next slide, please. This is also another source that I like to share, which is a Pima Community College West Campus Dental Clinic. They offer low-cost hygiene treatments to patients. So it offers the Pima dental hygiene students an opportunity to provide these services to the community as well. So it's a wonderful opportunity. And last slide. So this is our link to our webpage where you can find the information and the links to our digital consent forms. The consent forms are for kindergarten, second, and sixth grade. We also have the school application for the school staff. So since we've served more than 40 schools in the fall semester, many of you have pretty much met and worked with our team. We have Andrea, who is our dental hygienist and program coordinator. She schedules our visits to the schools. We have Matt, who is the RV driver and chaperone. He chaperones the students to and from the classrooms to the RV. So he's pretty much in charge of doing everything in a timely manner, keeps an eye on the lunch and makes sure that everything is coordinated correctly. So there's no interference with the lunch times. And also myself, Suzette, I am an experienced bilingual dental assistant. I joined the team about 4 or 5 months ago. So I'm very happy to be a part of this team as well. And that concludes the presentation.
Thank you so much, Zizep. And
You're very
again,
well.
if you have any questions for Zizette or our dental folks, please add it to the chat, or of course we will have time at the end for any other questions. I would like to say the dental sealant program is a really awesome program, and just to reiterate what she said, it does subtract from the time that students are out of the classroom to get their dental care done, and it's really cool that they can bring it to the schools itself. The next presenter is Laura from our clinics. Laura, are you on the call?
Yes, I am. Hi.
The floor is yours.
Thank you. I'm Laura Larson. I'm a nurse and I am the new immunization program manager for Pima County. I've been here for about 90 days, so I'm still kind of working through my role, but I'm really excited to be here. Next slide, please. As you've likely heard, we have had 3 measles cases in Pima County since the end of 2025. So obviously the best way to prevent measles is through vaccination. Our county does actually pretty darn good, but we are not fully at herd immunity, especially in the kindergarten and younger age. So we do have a little work still to go. Next slide, please. These are our clinics and hours. We have plenty of the MMR measles vaccine available for children and adults. We're no-cost clinics to patients. So if you have insurance, we will bill the insurance. If students don't have insurance, they do not get charged. Next slide, please. I would highly recommend all schools get this downloaded, get a copy. It's the Measles Toolkit from Arizona. You can Google it, and I'll also put the link to it in the chat after I'm done here. It has posters, it has signs and symptoms, it has next steps. It's a really nice tool and really easy to navigate. Next slide, please. Just a quick thing about it, just so we can talk just quickly. One thing to keep in mind is if there are exposures, the recommended stay-at-home time is 21 days if you do not have presumptive evidence of immunity. So what does that mean? For adults, it means one written documentation of a vaccine or laboratory evidence, the titers, or laboratory evidence that you've had the disease in the past, which most people won't have something like that. Or if you were born before 1957. If you were born before 1957, we were not giving the vaccine widely then, so most people are assumed to have contracted the disease and are therefore now immune. You are required as an adult to have 2 doses and written documentation of 2 doses if you're a high-risk adult. That would be international travelers, healthcare workers, college students. For children, it's age-specific, so if they have 1 dose up until the age of 4, they're considered immune. From 12 months to 4 to 6 years is when you get your second dose. So after the age of 4 to 6, I say 6, then you would have to have 2 documented doses. And if that dose, the second dose is given early, and sometimes it is, it still counts. So they will not have to get a 3rd dose later. I would encourage everyone to kind of be thinking about that in the big picture of things, making sure that staff has a documented case, a documented dose. If not, to go ahead and get one, then that way they don't have to worry about contracting, spreading, or being outside of work for any time if there was an exposure. Next slide, please. Next big news in immunization is that the CDC has changed their guidelines for what they are recommending for vaccines. They have kept quite a few of the required vaccines, or recommended, I should say, no vaccines are required. The recommended vaccines for children, however, they've moved some over into they only recommend it for high-risk groups, or they consider some of them to kind of go into that category, and also what they called shared clinical decision-making, which in layman's terms mean that you and your doctor talked about it and made a decision based on your child or your risk factors. I personally think that all vaccines would fall under shared clinical decision making because you have the opportunity. All vaccines are, agreed to, and there are options for people who don't want them, especially in Arizona and schools. As you all know, we have the opportunity for people to have personal and medical exemptions. So that's kind of where that is going for now. Next slide, please. So for Pima County and for Arizona HDS, right now, there hasn't been any direct communication from the CDC to AZHDS. So we are continuing business as usual. At this time, the vaccines required for school entry are the same, and the medical and personal exemptions are the same. We as a healthcare society will continue to advocate for the original vaccine schedule that is produced by the American Academy of Pediatrics and the American Academy of Family Physicians. And Arizona is also, as a state, still continuing to follow that guideline. In addition, insurance, public and private, have all vowed to continue to cover the original vaccine schedule, at least through 2026, or till 2026, I should say. And I've had a couple people from different schools reach out. We've had a few unique situations, and I anticipate we will continue to see things like that. So don't hesitate to reach out to me or reach out directly to the state to get some clarification on if we should be marking people as compliant, or, if they need to receive an exemption. And next slide, please. And finally, it's hard to believe that we're already talking about back to school, but we are. So we have started kind of making our back to school plans for vaccination clinics and things like that. We will have extended hours just like last year. We will also be doing a pretty large event over at the Keno complex. We did it last year. I think we incorporated sports physicals and vaccinations. And that plan does look to be to do that again this year. We do have a little bit less staff to do some of our outreach. However, we do plan to continue to be a strong partner for schools. So please do reach out to me. I did put my email address in the chat. If you would like us to come out and support any of your back to school activities for vaccinations, whether it's just I come and talk to people, or if you actually want us to be there to help deliver vaccines, we'll do what we can to support that and support you. And that is pretty much it for me. That's my contact information, my phone number. Once again, I am pretty new in this position, so it might take me a little while to find answers for you, but I will do my best to get answers for you in a timely manner. Thank you so much. And if you have any questions, I'm happy to answer them now, or you can reach out to me, phone or email.
Thank you so much, Laura. I really appreciate it. So now we had a little bit more of a shorter presentation this month, but if y'all have any questions, either for our dental program or epidemiologist or for Laura, now's the time. You can either put in the chat or come off mute. And we also, just for your guys' awareness, we also included a dental flyer that is in the chat as well, that if you want to either pass out within your schools or for families that you may know need it, of course, that is always available to you as well. Seeing no questions in the chat, we're going to go ahead and end the call a little bit early. And again, if y'all have any questions, we have a question from Cassidy. Is it possible to get the email from epidemiology that was sent out about 2 weeks ago that had staff and parents measles letter, as well as the flyer with signs and symptoms of measles? Yes, that is possible. We can get that out. We can send that out to you, Cassidy. We'll make sure to do that after this call. Of course. If there's no other questions, of course, you can contact us at 520-724-7018, or you can email us at schoolsupport@pima.gov. But with that being said, that is the end of our school health update call. Thank y'all so much. I hope y'all have a wonderful Wednesday, and we'll see you back here on March 4th. Thank y'all.